Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. Today I'm here with my very colorful and coiffed co-host, Dr. Millicent Ravello. How are you?
I am doing very well. How are you?
I'm great. You got the whole look pulled together.
Yeah, I'm doing this like princess thing today.
Yeah, and then you got the blue
got the
shoes to go with it.
yeah.
I mean, very, very awesome. Looks great.
Thanks.
And I am also here with our well-put-together patient who has decided to join us, Michaela.
Hi, guys.
Hi, welcome.
Thank you for having me.
Yeah, thanks for joining us. We're very excited to talk to you about your rhinoplasty journey. And I think our audience is always excited to hear about what it's like to go through the experience of having a rhinoplasty, of having plastic surgery in general. So we want to kind of run through it, if that's cool with you.
Yeah, absolutely.
Just from a standpoint, like, when did you wake up and say, I think I need to go get a nose job?
I think it was when I started actually looking at pictures, and the first thing I noticed was my nose. And I felt like you couldn't see my hazel eyes or my smile, and it's just like my nose was just the most prominent thing in photos. And I just didn't like that about it. Yeah.
Do you remember this?
Yeah, I do.
We're showing Michaela, and here's Dr. Ravello, you can see the pre-op photos.
Yeah.
So what was it? You just thought it was too big, too wide, too this, that, the other?
Yeah, I thought it was too big, too wide. I didn't like the tip, how it went downward. And then I did have a little hump, I believe, on the top slightly. Yes.
Yep, little hump there too. So this is the before. And you can see her now, so we've obviously made some rearrangements. But so those were kind of the things. It was too wide, dominating your face. Yeah. What age were you when that first came to mind? Were you 10, 14, 16?
I want to say I was about 18, really. I felt like when I was in middle school or early high school, it's just like, oh, my face is changing, I'm changing.
Right, everything's awkward at that age.
Correct, yeah. And so I feel like when I was actually in college, I'm like, okay, well, I should be pretty developed right now, and things weren't changing anymore. So I was like, okay, well, I need to do something about it. And that's kind of when I decided to think of rhinoplasty as an option.
And so did you then, at that point, you're like, okay, I think I need to get a nose job. How did you go about, what's the process that led you to, find your surgeon, which was me, but was it a lot of reading? Was it a lot of asking people? Was it referral?
So my dad has always been in the space, and so I kind of grew up around this type of stuff. And so I always kind of knew it was an option, but I never thought I would actually do it. And so I kind of went to him first and was like, hey, I really want to get rhinoplasty done. He's like, you're crazy, but okay. And I was like, do you know of anyone? And he was like, yeah, let me give you a couple of names. He goes, you look at them, you do your homework. And I said, perfect. So I looked at a couple of surgeons. I honestly went straight to their website and looked at their pictures, like before and after pictures. And I'm like, I don't like how these noses look. And they all kind of looked the same, depending on the surgeon. And so then I came across your website and I looked at your work and how aesthetically pleasing the noses were. And I was like, okay, I like that nose. I like that nose. I would be fine with that nose. And then that's when I decided to follow through and make an appointment with you and kind of go through the process.
I mean, we talk about that a lot.
You got to look at the befores and afters.
Right.
You got to like their work because that's what you're going to get.
Exactly.
It's gonna be the same, not the same nose, but you're going to get a version of a nose that they do.
Right.
Right.
And there are style points too. Like if you look at Dr. Ravello's like breasts on her, not her breasts, the breasts on her website.
You can look at my breasts. I'm cool with that.
But you know what I mean. You can see that there's a style to them. There's a style to the way that I do facelifts, the way that I do noses. So that there's a feel that you have to look at, and it has to agree with your aesthetic eye. It's really important, and I don't think people spend enough time with that because they are. We were joking about me bringing in the TikTok of the week, but they really are kind of going by things that are not relevant in terms of results. If a surgeon is a good dancer, I'm not sure that equates to excellent results in rhinoplasty.
Did you do